peritoneal surface, and they saw some abnormal nodules there, and they took out a few of those nodules. One of those nodules was positive, and you asked me, well, is this bad? Well, the peritoneal nodule surface that they took out, that's probably the most problematic because that nodule is farther away from everything else. And because of that, when you have these tumor deposits on the outside, with the inside the belly, but outside the colon, that is considered a metastasis or metastatic disease. So unfortunately, because of that, this is consistent with stage 4 colon cancer.
Because of the other ones over here?
Because of what they call the peritoneal surface, the tumor deposits. So the tumor deposits are the little drops of the cancer cells that are on the inside of the belly, but along the lining of it.
We probably don't understand, do we?
Well, the best way, if you want to keep it for record's sake, is to get a copy of her pathology results. That's probably got all the most detailed information out there.
Metastatic is gonna go to her liver.
Well, it's not that it's going to her liver. It is already spread to some of the areas within the lining of her belly. The problem with these peritoneal nodules is they're hard to see, even on the CT scan, which is why they didn't know that it was there before. These nodules are very small. They often get buried in all the fatty tissue in the belly. They can be very small that the CT scan doesn't catch them. So oftentimes when people have surgery, the surgeon get in there and they see with their eyes that there's something abnormal, and they go, oh, that doesn't look right. And they took a sample from that, and that's what they found. Where we're dealing with now is you have had a CAT scan of the belly. We haven't done a CAT scan of the chest yet. What I like to do is do a CAT scan of the chest to see if there's any signs of cancer anywhere else. Okay, that's number one. Number two, because of the cancer being stage 4, typically what we in general, the rule of thumb for stage 4 cancer that is it is treatable, but generally not considered curable, which means that there are options, there are chemotherapy, there are immunotherapy options that we can consider to help to try to reduce the risk of that the cancer could spread to somewhere else, try to keep the cancer from growing even bigger. But unfortunately, in the rule of thumb for most stage 4 cancers, that we can treat it but can't cure it, which also means that eventually the cancer may get better for some period of time, but eventually it may find its way around it, and we'll have to switch to different chemo, and it's a marathon, not a sprint. So you already had, like I said, we need to do a CAT scan of the chest. And with this case, I would recommend that we would need a chemotherapy for this. And I think Dr. Singh did you a favor by taking the big cancer out, because that frees you up from, and it gives you some additional options. Because anytime we have a big tumor in the gut, you worry that it's going to cause a blockage. And it cause, even in rare cases, cause a bowel to essentially explode in the belly because nothing can get through. So the fact that he's already taken the bulk of the cancer out not only allows you to have normal bowel movements, but we were less concerned about a complete blockage of your gut because the big tumor is out. So for the treatment options, typically we would recommend a 2 or 3 drug chemotherapy option. In your case, the typical regimen we often start with is called a FOLFOX, which is made of 2 drugs, 5-FU and oxaliplatin. And because the fact that your tumor is gone, the big tumor is out, allows us to add a third drug called Avastin. It's not chemotherapy, but it's actually a biological agent that can show to boost some of the response.
He said something about putting in a port.
A port, yes. Because all of this drugs are IV, you will need a port because that will allow us to give the treatment through. The first two drugs are chemo. Now today, it's not intended, I know it's a lot of information for you to take in, so it's not intended for you to digest everything. You will have a separate class for chemotherapy education. So once we get authorization for the drugs, my staff will call you and bring you back in for a 1 hour visit with one of my nurse practitioners. They're gonna make a folder for you with specific drugs that you're gonna get in the binder, and they're gonna go over you with all the potential side effects of drugs, what to expect, what kind of problems you may run into, how do you manage the side effects. They're gonna spend a whole hour with you just going through the drug side effects. So you will have a much more in-depth discussion. Today, the purpose is really to lay out the drugs, give you at least some sense of what their treatment looks like, and then you're gonna get more information on the specific drugs at the next class, chemotherapy education class. Make sense? So it's gonna feel like drinking from a fire hydrant a little bit today, but I want you to focus more on the big picture today. What are we gonna do? What is the stage of the cancer? What are we gonna do in terms of the broad treatment regimen? In terms of the specific side effects of the drug, we're gonna have a separate class for you just to go over all of that. Okay.
And what is the life expectancy?
So, colon cancer treatment has come a long way. Not all stage 4 colon cancers are the same. Some colon cancer patients may have a few spots of cancer inside their belly. Some stage 4 colon cancers may have cancer all throughout their liver. Every colon cancer, just because it's stage 4, doesn't mean the outcome for every stage 4 colon cancer is the same. It really depends on lots of factors, including how extensive the cancer is, how aggressive the cancer is, how much cancer there is outside the colon, your age, your other health problems. All of those will factor into how much time you may have. So if on the individual basis, you're asking me how much time you have, I have no idea. Just because we don't know how well you're going to tolerate chemo, we don't know how long the chemo will work, we don't know if you're going to run into any major side effects or any complications, and we don't know how your body handles all of this. So there are lots and lots of variables. So I really would not be able to tell you, say, hey, if you do this and this and this, here's how much time you got. Unfortunately, we don't have the ability to do that. Now, I would say statistically, stage 4 colon cancer has come a long way. The old historical data showed that patients with stage 4 colon cancer at 2 to 3 years, usually about 30% of people are still alive. But that's really old data. Now the treatment cancer has come a long way, so the average life expectancy for stage 4 colon cancer has gotten longer. But that's why, but again, it depends on so many individual factors that I really, I'm hesitant to give you a number because truthfully, no one knows what that number is.
Metastasized stage 4 isn't long.
I'm sorry?
Metastasized stage 4, you don't live long.
Well, that's what we're just talking about. That is, we don't really know how much time she has with treatment. Historically, at 2 years from the time of diagnosis for people with stage 4 colon cancer, about 20 to 30% of people are still alive
2 years
with treatment. But we don't know, that number has changed or evolved over time, and people likely are living longer now with stage 4 colon cancer than they did before. We just can't predict how much time she has because there are lots of factors that we just don't know how it's going to affect her treatment. So right now, what we can do is get the port in, get a CAT scan done, And then my goal is to get you started on treatment probably in a couple of weeks, so that by then we'll have the port, we'll have the CAT scan done, and then we can get you set off with a chemotherapy education class, and then we'll get started on the treatment. Now the 2 drugs, going back to the regimen a little bit, this regimen is made of 3 drugs. 2 of them are chemo, 1 of them is not. The 5-FU is actually a pump that you go home with. So let's say, I'm just making up dates. Okay, let's say next Monday you come here for drugs. We're gonna give you this drug, oxaliplatin, just through the port, and Avastin through the port. Then you're actually gonna go home with a pump with a 5-FU, and it's already pre-programmed to run on its own for 48 hours, so 2 days. So you go home, you have this fanny pack that has a tubing that runs into your port, and it's gonna stay taped in so it doesn't fall out. It runs by itself for 2 days. On Wednesday, that week, you come back in, we take the pump down, take the needle out, and that's that. And then 2 weeks from that, we'll do it again. So every 2 weeks, so from the start of each treatment, every 2 weeks, you will get a round of chemo. And depending on how you tolerate it, we may make some adjustments to the dosages of chemotherapy, which drug can stay on, which one drugs can get dropped over time. But as long as you're able to tolerate the treatment, and as long as your cancer is responding to treatment, you're going to be needing the chemo. There are few cases where someone has had such a great response to chemo that after 6 months, a year, we don't see any signs of cancer, we go, well, maybe we can take a break. But that's usually an exception to the rule. That is generally not usually the general expectation. Because for stage 4 cancer, it is treated, you treat it until it either stops working or the body can't take it anymore.
How did it get to stage 4 without me knowing?
Well, the long and short is time. The reason we recommend the colonoscopy once every 5 to 10 years is to hope that you catch it early. But once it has time to grow, and over the course of many years, usually this happens over the course of years, not months. Over the course of years, it grows and grows and grows, and it just continues to spread. Eventually, if you left alone, because you did know, you just found out late, because the mass was so big that was blocking the bowel.
But I've never had any symptoms, none.
Correct. The reason being that the belly has so much room for cancer to grow, and as it gets bigger, it just pushes everything else out of the way, that it doesn't usually show up until it's late. Unlike, cancer of the brain, for example. There has no place to grow. If it starts growing, pushes out everything else, the skull keeps everything contained. So even a small area can cause a lot of problems. Whereas in the belly, because it has so much room to just move things around, stage, colon cancer, stomach cancer, pancreatic cancer are all oftentimes found late, just because you don't know this there until it gets really advanced. Now, of course, colonoscopy is a good preventative measure for colon cancer. We don't have that for stomach cancer or pancreatic cancer yet.
So what do I actually have? Colon cancer or stomach cancer?
You have colon.
Oh.
Yeah. Again, going back to the picture, the cancer started in the cecum, which is the first part of the colon.
And usually that part, they don't have a bag on the side of you.
No, they don't, because you have plenty of bowel that you can reconnect everything else. So not usually, no.
What about her hair?
The hair will get thinner, and you will need to see some hair loss. Everybody's body responds differently. Some people notice hair thinning, other people notice more complete or more extensive hair loss. Yes, but the long short, you will see some hair loss. Any other questions so far?
We better ask him, baby.
I know, but I can't think of anything.
Well, that's out of all the things you could have told us, that's like the worst one.
Yes,
Yes.
but unfortunately, I also have to tell you what I know, because it doesn't make sense for me to hide the information from you. Because I think you need
Oh,
to
no,
know.
I don't want you to do
I
that.
think you need to know what you're getting yourself into. You know what the goal of a treatment is. If I tell you, oh, you know, it's okay, we'll just do some chemo and let's see how it goes. 6 months from now, you go see another doctor. They say, well, you had stage 4 cancer. Did you know? You go, well, no one ever told me. I mean, I don't want that to happen. I think my approach is tell you what I know. It doesn't make sense for you to not to hold any information back, because it's your health you're dealing with.
So what will Zach be doing Friday?
So one is they're gonna make sure you're healing okay after the surgery, and number two, they're gonna be talking to you about when to put a port in.
Okay.
I will send Zach a message to let him know that you and I talked about the chemotherapy, and I need him to go on and arrange for a port, so that's something that he can definitely work on.
Mm-hmm.
Because until I have a port, I can't do the chemo, so I do need him to be able to get that done.
So the chemo treatments, I would come here and you would do the port.
So what happens is once you have the port in, you come here usually the day before your treatment to do blood work. We'll check in with you, make sure you're doing okay. And then if the labs look okay, your blood counts are not too low, you're otherwise feeling okay, and we can do chemo, the next day you just come back and do chemotherapy, do the actual infusion. The infusion center where you actually get a chemo is just in the hospital. So it's actually down at the basement level of the hospital called there's a cancer center where we have lots of the infusion chairs. It's probably where are you getting your treatment for rheumatology? In the rheumatologist office?
Yeah, and I can't think of his name, here in Gaston.
Yeah, the rheumatologists used to use the infusion center for their drugs down in the basement level of the hospital, if you haven't had that before.
Yeah, it wasn't in the hospital.
Yeah, they started doing them in their office now,
Yeah.
but they used the shared infusion room with us. But the infusion center in the basement level of the hospital, there's separate entrance and everything. You just go in and get your.
So it's just like me getting the symphony.
Exactly right.
Okay.
Just a little bit.
And how long does it take?
Involved?
Each
3 or 4
treatment?
hours.
How many?
3 or 4 hours. That's the reason why we do blood work the day before, because if you do the blood work on the same day off, sometimes you wait up an hour and a half for blood work to come back. It just ends up being a really, really long day. We have to do them all at once.
Okay.
Now today, I typically, because you had a surgery, typically I will start with the first two drugs, give you a couple of treatments, make sure you do okay. If you do okay, I will add the Avastin on third. The reason being I give you a little bit more time for the wound to heal. So when you first start chemo, let's say, again, I'm just tentatively picking on the date, let's say the 30th, which is a Wednesday. The Wednesday, the 31st rather. You will come in the day before for labs, and once we have and you will come back on a Friday for chemo, coming back on a Friday to get the pump taken down.
Okay.
And once you do okay after the first 2 treatments, then I will add on the second drug just to give you a chance because sometimes Avastin can affect wound healing. So I usually wait a little bit just to give a little bit more time for everything to heal up. And now by late February, when you're ready to start this drug, you're already a couple months out from the surgery, and sure at that point it shouldn't be a problem.
Mm-hmm.
Okay. Any other questions?
Okay.
Now, like I said, once we get authorization for the chemo, you will we'll contact you directly to set up a chemotherapy education class. So you will sit down and go over with one of my nurse practitioners about all the side effects, what to expect. I am going to send you a few medicines for you to keep at home right now as a backup. They're for nausea, diarrhea, and one of them is a steroid that you take for a couple of days after chemo. It's got a lot of instructions on them.
Okay.
Some are going to say take as needed.
Okay.
Others are going to say take for 2 days after each day of chemo. So it's going to all have the instructions on it. You don't have to start taking any of these medicines. They're in preparation for the chemo.
Okay.
So once you get them, just hold on to them for now. You don't have to start taking any of them. And if you read the instructions and it doesn't make sense or you have questions, just bring them to your chemotherapy education class. We're happy to review it for you and go over exactly how to take them. Okay. Now, assuming that we get you started on treatment on the 31st, which is a Wednesday, I typically see people back at the start of their next cycle of treatment so that we can check up on you, make sure you did okay. So if we stay on track and get you started on treatment on the 31st, okay, January 31st, then I will see you back on February 13th before your next treatment and make sure that the first one went okay, make sure you don't have any problems, and then we can make any changes if we need to. Okay? And for now, I will get you set up for a lab appointment on the 30th before your first treatment. And once we get authorization, we'll add on the chemotherapy education to the 30th as well, so you can kill two birds.
And the lab is here?
Yep, lab is here. Any other questions? Okay. I'll talk to Zach about getting the port here, and I'll go in order the CT chest as well. So those will hopefully we should have plenty of time to get that done before you start. All right. Anything else I can help answer today?
No.
Okay. If you don't mind waiting here for a minute, I'll get you to check you out, and then we'll get Sarah to check you out. If it is okay, what I like to do is recheck your blood work today. I know you're gonna have some blood work again in a couple weeks. The reason being that when you left the hospital, you were still a little bit anemic, and I just want to check to see if you're iron deficient.
Okay.
Because if you are, we can actually fix that with some IV iron infusion. What that will do is that will bring your iron level up, bring your red blood cell count back to the normal range. Because we know chemo is going to lower the blood count. So if we can raise it up and then get, kind of buy us a little bit of cushion, then we'll have some wiggle room to work with. So what I'll do today is I'll check some blood work, and I will call you if you're still really iron deficient.
Okay.
Because in that case, we can get you set up for some IV iron infusion to get your iron level up a little bit quicker. And that should get you feel a little bit better too. Any other questions?
Would she be susceptible to getting sick faster, easier?
Yes. The long and short is she is a little bit, her immune system will be a bit weaker. So she will be at higher risk for infection while getting chemo. With that said, we generally don't recommend people to, live in a bubble. The most important thing is, one, get your regular vaccines, including, your flu shots, your COVID shots. The other part is make sure you carry a bottle of hand sanitizer, wash your hands regularly. If you
wear a mask.
If you're out in public, especially in crowded areas, a lot of just mostly common sense stuff, nothing extraordinary, but we do recommend that you kind of pay a little bit more attention. So regular hand washing, wear a mask if you go out to the public. Probably don't want to go to a mall on a Saturday afternoon at 2 o'clock. Those kind of things where there tend to be lots of people and somebody is bound to be sick that is still out and about. So again, nothing extraordinary, but mostly just common sense stuff that can help. Okay. All right. If you don't mind, hang on here for a minute.
Okay.
I'll get Sarah, check you out, I'll get these appointments scheduled,
Thank
okay?
you.
All right, good to meet you guys.
You gonna be able to handle this? Are you gonna fight it? Or are you gonna lay down?